Okay, we are a 45-bed freestanding rehab hospital. We are 2 levels with 3 wings. On this level, our patient care, this is one of the rooms I show because it makes us different and stand out. This is our overhead tracking system. So it can be either what we consider a traditional Hoyer or also a modified harness walking system. So anywhere the track is, the patient can be mobile and move. So if you want them to walk to the window, they can do that. If you want them to get out on either side of the bed, they can do that. So wherever the track is, the patient can be moved. Our overhead motors can tolerate up to 600 pounds. So it can be your traditional Hoyer or a standing harness walking system.
And you would say modified light gate, what is that?
Well, the modified light gate is for our 3 mobile Hoyers. So this is a harnessed walking system. So it's a groin strap with a hook. You hook it up and the patient can walk and stand and the therapist can be more hands-on. The modified light gate is for the 3 harnessed mobile Hoyers made by the same exact company, same exact crossbar system, but you can raise the crossbar up and then you can move the patient and walk them out into the hallways and away from the track. Now that capacity on weight limit is 350 pounds, so they don't have the capacity as our overhead track does. We have private bathrooms as well, so good grab bar placement, great space. All of our doorway widths accommodate any type of bariatric equipment. However, if we do get some need for outside of this width, then we have a bathing suite upstairs, which I can show you. Any questions? Yes, beds. We have the Lynette beds, which are fantastic. They are a little bit of an upgrade when it comes to the mattress and the density. They are very user-friendly. We promote that independence and mobility with our patients by allowing them to raise and lower the bed depending on what height accommodates their ability to get up, allows patients to be a little bit more independent. Love that feature.
And the actual mattress is just, it's like
It's not the standard, it's not like the mattresses that they have, but it's got a little bit of, it's got a little bit of a waffle feel to it, and the density is a little bit more supportive than your standard just foam mattress. So patients love that. Sleep and food. We have good food and we have good comfortable mattresses to sleep on. So we can accommodate, even if our beds do go up to 400 pounds. However, usually with a bariatric patients, it's more of the width. And so we do contract out and get those supplies, anything that we need when it comes to walkers, wheelchairs, beds, air mattresses, anything that accommodate the bariatric patient, we can do that. Or any other patient, we can get it if we don't have it. On each wing, we have a negative pressure or reverse isolation room. So if we have that need, we can accommodate that patient here in our facility. All of our rooms are private, so we can accommodate any isolation, but if we specifically need the negative pressure, reverse isolation, or negative pressure isolation room, for example, like a TB patient, we can accommodate that. Our respiratory department does all of our own fit testing, so we can have our therapists fit tested with the correct masks so that we can treat those patients safely. 1 on each wing. And then we have a wonderful pool. It is a saltwater pool, which does cause some discoloration, and I like to make sure and point that out because if you look at it, you may think that it looks dirty, but I always explain the salt water is much better for our patient's skin, it's better for our therapists that are in there, but it does make, because of the iodine, it does cause some discoloration to the pool, which will consistently change and get darker or lighter in spots, but it is not dirty. We do have our underwater treadmill, which is something that we've seen some really good research right now on with our Parkinson's patients. And so that is something that we are using with our patients and non-Parkinson's patients. We don't store it in the pool again because of the salt. It does wear on your equipment, but we do take that and use that with our patients depending on the need. Do you want to show the locker rooms? I won't hit you with the door. We have men's and women's locker rooms, both for staff and or patients, so we can You can keep your supplies in the closet, and then we also have an accessible door or a bathroom here. There. 350 weight limit on that. Most things are 350 unless it kicks into the bariatric, and then it's over that. We also have our lift, which allows patients that are not able to, because of whatever mobility need, walk up and down the ramp or wheel up and down the ramp. We can get them on the harness or the lift and get them into the pool as well, if they're non-ambulatory. This is labeled our outpatient gym. However, I like to call it Gym 1 because it allows it just allows us another space. We bring our outpatients upstairs and we bring our inpatients downstairs depending on what the need is of that patient. We really are trying to establish a culture of doing what's most appropriate and clinically best for the patient. So if that involves the equipment down here or the space down here, we bring them down. If there's an outpatient that needs our overhead track or mobility system upstairs, we bring them upstairs. Some of the things that makes our facility be able to address that neurological population is our BioNest H200 L300. It's functional e-stim. So it allows you to put the electrodes on the patient's hand. They can open and close their hand. Same thing on the patient's leg. And it allows them to pick up their toe when they walk. So we decrease that use and need of AFOs before the patient is technically ready for that kind of device. We do have 2 of our LSVT certified speech therapists on site, and this will be primarily the room used for that. We are installing the system as of right now. It's a computer system, but they just need a quiet space where they can have a microphone. So we'll start using that as our LSVT room as we have those patients come in. We have 2 private treatment rooms, depending on what the outpatient need is. So that is an option if we have any type of modality that would require some type of disrobing. We can allow that private space. And then we have a beautiful campus. So one of the things that makes us a little bit unique is our outdoor mobility track. And it has asphalt, gravel, cobblestone, terrain change, stairs. It's great to get your patients outside. And then just our campus itself. The sidewalk that goes around our campus has great incline, decline for that community mobility piece. That's very, very important to our wheelchair-bound patients, and also allows a pretty good workout. Okay, this is our BIT system. It is the BioNest Integrated Therapy System, BITS, all caps. It is the first one in Kansas and is a fantastic device. It has 17 programs. It has anything from vestibular to ocular motor to scanning. It has a multi-pixeled screen so that it's touch screen. So you can make it as gross motor or as fine motor as you need it, but allows patients to be up on their feet, very functional. Takes up a really small footprint, and it is for PTs, OTs, or speech therapists. All 3 disciplines can use it. So it's a great device. It's mobile. We can take it wherever we need it, and it takes up a small amount of space. The screen raises and lowers, so if your patient is able to get up or if they need to be in quadruped or sitting on a ball, it can be a really dynamic piece of equipment that we can use. And then one other thing that makes us very unique is our overhead track system, and that is exactly the same harness system that is in the patient's rooms. And it allows us to get our patients up and walk very, very soon, usually day 1, if not day 2, and allows that early mobility, getting patients up with as minimal devices as possible. You know, you have to put a walker in front of someone when you are helping them. With this device, you can have someone stand if they were not using a walker before. You can allow them to get up onto their feet with as little hands-on and as little device as possible, which is great for our neurological patients, or any patients with fear, anxiety, and that track goes to the same. It's also a 600-pound motor. So this is our IADL area, and this allows us to work on those activities that are a little bit higher level, but that everyone has to do at home. So we have our tub for tub transfers. We use this as a clothesline for standing and functional reach. That's one thing that we're really trying to do here is our therapists are used to doing things that are functional and standing on their feet, being up, working on transfers. We do go by FIMS here, which is those things that we kind of take for granted at home, walking, transfers, getting yourself dressed, feeding yourself, all of those good things. So we do not have putty, we do not have pegs, we do very little sitting hand activities. Everything is up in functional reach, which then leads us into our kitchen area. This is also another functional space. We have a washer and dryer. We have a kitchen area. The washer and dryer is for demonstration use only. We do not have patients wash their clothes in here because we do have a locked unit on the nursing wing that allows us to help our patients with the chemicals and the soap to keep us in compliance with any type of infection control issues. This is more for functional reach, balance, prehension, dexterity, anything that that patient needs to do when they get home, as well as our kitchen. We can make meals, they can make snacks, they can help. One thing that we also do in here is their therapeutic dining. This is where patients who need help or are on modified diets come in and eat. And so they can prepare their own thick and liquids if that's something that they're going to have to do at home. Our speech therapists are great about incorporating that functional piece into the therapeutic dining piece. So we do bring patients in here to just allow them some privacy while they're eating. I feel that definitely affects that dignity component when you're not having people watch you eat. So it's a nice, private, small space. This wing is our brain injury unit. So on this side, we also have our third gym, which is our quiet gym. It allows us to get patients out of their room and down in this area if they need a little bit more stimulus than their room can provide, but that are not maybe quite ready for their therapy gym yet with all of the noise and the activity that goes on in there. This is our tilt table, which allows us to get patients who are not able to stand up onto their feet. You can adjust how upright they become. If there's a blood pressure issue, we can really customize that treatment, but again, getting a patient up versus leaving them in a wheelchair. On our brain injury unit, this is one thing that makes this wing different from our other two wings. If we have a patient who has been recently on a one-to-one or maybe be a little bit more impulsive, which sometimes our brain injured patients are, we can have someone sitting at this desk and keep 2 eyes on 2 rooms. It allows us to have a little bit more visual. You can see into both sides, but yet we can still provide privacy if we need. But it allows us to get more eyes on those patients that are at risk to fall and will be up quickly. We do also do on-site dialysis, on-site x-rays, and on-site labs. So the patients get dialysis in the privacy of their room, in the comfort of their bed. We can also modify diets with our modified barium swallows, which we do on-site downstairs with our x-ray and our speech therapists. A couple of the things that makes us a little bit different from our competitors is the fact that we do really try to focus on customizing our therapy programs. So if that includes spreading therapy out over 7 days, we can do that. The guideline or the suggestion is 15 hours over 7 days, which looks very different for each patient depending on what their abilities are. If they can tolerate 4 hours every day, great. We'll try to give you 4 hours every day. If you can't tolerate that much and can only do a couple hours a day, 2.5, 2.25, whatever the need is, we try to make sure and customize the therapy program. We can do those modified intensity programs for those patients that are a little bit lower level starting, depending on what the need is. We do have therapy Monday through Fridays, so we do not do the Monday through Sundays, 7 days a week of therapy. Monday through Friday is a little bit more intense. We've gotten some really good feedback from our patients that they like to have a little bit more downtime on the weekend. So the weekends can be 1.5 to 2.5 to 4 hours, again, depending on the patient's need and abilities. And then we do not do groups. So the therapy that they do have on Saturdays and Sundays is with a therapist, one-on-one. The only group we provide is therapeutic dining, and that is twice a day by our speech therapists and our occupational therapists. And that's it.